In this video, I want to talk with you about the physically feeble fallacy. I want to explain what it is and how it affects your mind and your body. If you watch through to the end of this video, I'm also going to explain how you can protect yourself from the physically feeble fallacy so that you can enjoy a body that moves right and feels right. So if you're ready, let's get ready to think right, move right, and feel right. First, let's talk about what the physically feeble fallacy is, and then let's look at some examples of it so that you can understand how it shows up in your life and how to avoid the influence of the physically feeble fallacy. The fallacy takes two main forms that can vary a little bit depending on the circumstance. The first major form is, I cannot do this, therefore others cannot or should not. The second major form this takes is, I observe other people cannot do this thing, therefore we and pretty much everybody cannot or should not. The power of this fallacy can be amplified by perceived expertise and or authority. For example, doctors, surgeons, and physical therapists are common offenders, often telling people to avoid perfectly normal and natural human movements simply because they themselves cannot do it or because they observe that many people lack the basic fundamental movement ability to do these motions. Weightlifting bros and bodybuilders are also common offenders. Their muscle mass gives them the appearance of expertise in all things related to the human body, but often they may not understand functional movement and training principles. So let's look at a few more examples of how the physically feeble fallacy shows up in real life. Example number one, you can't touch your toes.
Can't touch this.
A doctor who is completely unable to touch his own toes tells you that you shouldn't even bother trying to touch your toes because there's no safe way to do it and it's genetically impossible for you if you can't do it already. The fact that he himself has never bothered to research or learn how he might even be able to touch his toes doesn't seem to shake his confidence in his conclusions. And there's really no evidence that will stop him from making the really illogical claim that if you can't touch your toes, it's a genetic problem. After all, while he was in med school, he probably learned about Davis's law, which talks about how soft tissues remodel based on usage. Example 2, you cannot squat. A big, muscular, burly dude who can deadlift hundreds of pounds and squat hundreds of pounds cannot do a deep body weight squat. He tells you and everybody who will listen that it is actually not really a necessary human movement to be able to do a deep, primal Asian squat. He'll claim that the problem is that he's too tall, or his bones are too long or too short, or that it's just genetics because his bones are misshapen. But he won't consider that maybe the way he trains his body and his muscles is affecting what his muscles are able to do. He tells you that if you can't do a deep Asian squat, it's nothing to do with how you train. It just has to do with your genetics or some other external factor beyond your control. He's simply blind to the fact that all of the training he's done to build this big, massive, burly body has not been training his basic flexibility and mobility, and that is why he cannot do a deep, primal Asian squat. Hey, I want to say a big thanks to Barbara, Victoria, Dina, and Odd Night for your support of my channel. If you want to support this channel too, use the thanks button down below or the links that you'll find in the description box. And hey, don't forget, you can click the join button down below to become a supporting member. Example number 3, you shouldn't lift weights. A woman who has never safely learned how to lift weights and never had any instruction in weightlifting and never even watched videos on proper weightlifting techniques goes ahead and starts to lift weights that are too heavy for her one day. The result, predictably, is that she hurts herself by overdoing certain exercises or just using too heavy a weight. 10 years later, she tells everybody she knows that weightlifting is dangerous because she's still nursing the injury and the pain that started from that one session she had 10 years ago. Since that time, her hips and shoulders have all started to ache on a regular basis, and her body just hurts all the time despite getting many massages every month trying to work out the tension. She is not open to the idea that her aches and pains may be due to atrophy and lack of use and muscle imbalances. She's still on the search for that perfect massage that is going to take away all her muscle problems. If you ask her, she'll tell you, never, ever use weights or you're going to hurt your muscles. Example 4, you need surgery to fix your hip pain. A woman had hip surgery to fix her hip pain, and unfortunately the surgery didn't work. Her surgeon told her that she needed to have another surgery to fix the residual hip pain, and she underwent that surgery too. That surgery didn't work, and after 4 surgeries, she's still in hip pain. When she finds out that you have hip pain too, she tells you very strongly that you absolutely need to get your hip surgery now to fix your hip pain, because there's no solution to hip pain besides hip surgery. Unfortunately, this woman has been infected with the idea that surgery is the only way to fix hip pain. The orthopedic surgeon's theoretical construct and understanding of hip pain has fully infected her brain, and she only sees the perspective that the surgeon sees. In this perspective, the muscles don't really matter. They're just things to move out of the way while you go cut some bones and other structures. The authority behind the surgeon's pronouncements and this woman's unfortunate heart-wrenching experience makes it seem like her advice makes a lot of sense. Unfortunately, it's easy to lose sight of the larger lesson, which is that the hip surgery didn't work for her, and multiple hip surgeries still haven't worked for her. But because she's been convinced there's nothing she can do to fix her own body, she wants you to know you need to follow the same path right now to save yourself from the same pain she's going through still. Example number 5, your arthritis is the problem. A doctor who is too weak to lift a 10-pound box from the floor tells you that the only safe way for you to lift anything off of the floor is to bend your knees and never bend at your spine. When you attempt to use this method, you hurt your knees. When presented with this problem, this doctor will tell you, well, it's because you're old and you have arthritic knees. There's nothing you can do about it. It happens to all of us. All this doctor's advice revolves around the belief that weakness is a natural state and a completely unavoidable state. There is no way to correct weakness. The only thing you can do in your life is avoid situations that might highlight your weakness. Unfortunately, this becomes a self-fulfilling prophecy. The more you avoid situations that challenge your muscles, the weaker your muscles get. The weaker your muscles get, the more activities you're going to have to avoid showing how weak you're getting. All of this comes back to the fact that the doctor is weak, believes that being weak is the normal state and that there's nothing to be done about being weak, and therefore you should be weak. So why is the physically feeble fallacy so popular, and how does it spread and infect our minds so easily?
And before we go on, I want to ask you a quick question. Where have you heard the physically feeble fallacy? What forms did it take? Who told you something that made you think being physically feeble was your best and only option? Did you believe it, and do you believe it now? I'm curious to hear what your experiences were with the physically feeble fallacy, so drop me a comment down below.
As I mentioned, perceived authority and expertise play a huge role in this. If somebody in a lab coat or with a lot of degrees, certification, initial thingies behind their name says something, it sounds like they must know something. And if you don't have a lot of initials behind your name, what do you know? In addition, the theories associated with the physically feeble fallacy invariably place the blame for the suffering that you're experiencing on something beyond your control. That means you have no responsibility, and therefore you feel a lot better that it's not your fault. When somebody offers you a theory that says, hey, this isn't your fault, this is totally beyond your control, it can often be very seductive because you don't want to take the blame for your own suffering. But it's really important to zoom out and realize what kind of expertise and authority you're dealing with. It's important for you to recognize and remember that medical students enter medical school in their 20s after many years of rigorous academic study. Being a really good academic student does not make you an expert in human movement, nor does it give you the requisite experience and knowledge to understand how the body is supposed to move. Now, you might be thinking that doctors in medical school learn a lot about human movement, and they learn about the muscles and human movement principles so that they can help people with joint pain, back pain, shoulder, hip pain, whatever pain. Unfortunately, that's not the case, and in the United States, the vast majority of medical schools spend less than 2 weeks of time on human anatomy and movement. Now consider that young, impressionable medical students do not have the life experience or the human movement experience and training to judiciously weigh what they're told about how the body works. They lack the life experience, the motivation, and frankly, any free time to do outside research on whatever propaganda they're fed or whatever myths they're fed about how broken your body is supposed to be. This situation makes it very easy for the physically feeble fallacy to propagate medical myths all over the place. So now let's talk about how to protect yourself. The best antidote to the physically feeble fallacy is twofold. When you find a position or a movement that's difficult or uncomfortable for you, accept no excuses or rationales that remove your personal responsibility from the equation. Instead, turn your attention back to your lifestyle habits and the way you're training your body. Consider what changes might actually improve the situation, even if it means it's on a slow, gradual timeline. And the second strategy is to ATM always think muscles. Don't get caught up in all the little details that come along with the weird physically feeble fallacious theories that swirl around your hip or your knees or your back pain or whatever pain. Focus on your muscles because you can control them. That is something well within your control that you can work on a regular basis that will very clearly improve your movement and postural capabilities. Remember that your muscles move your bones. They are responsible for positioning your body in space, fighting with gravity, fighting with other people, fighting with animals, fighting with weeds. Your muscles are what make body positions possible. So if there are positions that are not comfortable, that you can't quite achieve, it's because of your muscles. For more resources to help you wrap your mind around all this, check out the links that I'm going to have in the description box. I also strongly recommend you check out these videos here. Support this channel by hitting the thanks button or using the PayPal link down below. And I promise I will not use your money to pay for a needless orthopedic surgery. Like, share, and subscribe with the bell notification on. And as always, I hope you remember that pain sucks, life shouldn't.